Good afternoon and welcome back to the afternoon session of the Martin House Research Centre Conference. This is our next plenary involving experts by experience in the research process, what it's like and why it's important. And I'm going to hand over to Dr. Jo Taylor, our PPI lead. Thanks, Jo.
So welcome to the session this afternoon that's about involving experts by experience in research. We're going to start with me just giving a short presentation about what we sometimes refer to as patient and public involvement is, because some of you in the audience will be well aware what it is, others might not have heard of this or know much about it, what it's like and why it's important. And then I'm going to share with you a recording that some of the parents that we're working with within the Martin House Research Centre put together for you today, to hear their perspectives on why PPI is important and some of their experiences. And then we're going to open up for some questions, and I'm going to be joined by Lorna and some of the parents that we're working with in the centre, so you have an opportunity to ask us some questions. So what is public involvement? So involvement occurs when members of the public are actively involved in research projects and organisations. So it's not the same as participation, which is about taking part in research, so sharing experiences, sharing information that researchers then take away and analyse. And it's not quite the same as engagement, which is where researchers will share and discuss research with the public as a means to engaging them in our research. It's very much about working with members of the public in research. And when we talk about the public, who are the public? So this picture here is some members of our family advisory board, but in general, the public includes patients, potential patients, carers, and people who use services. So in other words, experts by experience. And the scope of public involvement is really quite large. I mean, this is the research cycle, and the research cycle starts with that sort of identifying and prioritizing of research through to the sort of funding and carrying out research, and then thinking about what our findings mean and developing key messages and thinking about who we're going to share those messages with, and through to thinking about, well, actually, how can we use our research to improve patient care and change practices and services. And members of the public, so in our case, children and their families, can be involved in all different aspects of research, so right through that research cycle, and it will vary from study to study, but we really need to be thinking about it, you know, from the very moment we start to think about what research is important, through to translating that research into making changes in practice. And in terms of how it sort of works in practice, it varies from research study to research study. And there are three main sort of models, really. So there's the model where we will often, as researchers, establish a panel of, you know, in our case, children and families, a group who will advise us on our research and work with us. There's the more integrated model, which I think is happening more often now, where members of the public will become members of research teams and sit on advisory groups alongside other experts, so clinical experts as well as research experts. And then increasingly, there's this sort of outreach model where, as researchers, we will work with existing groups, and they might be groups that have been set up by other researchers or healthcare services, but they may also be nothing to do with research and healthcare. They might be community groups, and it's a really great way to increase the diversity of the people that we work with when we do public involvement. And increasingly, we're using a blend of the three, I think, really to make the most of working with people. So in the Martin House Research Centre, and this is the only slide I've got about our centre really, because I wanted this to be more about sort of PPI and what it means and why it's important. We have a PPI lead, so that's me, and we also have a PPI coordinator who's one of our research fellows. We have a strategy that has sort of clear measurable objectives that we've co-produced with the Family Advisory Board. We have our Family Advisory Board, and that was established very early on in the centre, and that's parents and other adult members of children with a life-limiting condition, and we've been really working very closely with them throughout the last 3 years. And we've more recently established a young adult group, and we are co-producing some research that matters to them around improving hospital stays for young adults. We also have representation of parents on the centre advisory board, so sort of an independent advisory board, a critical friend. And then we have individual PPI plans for each of our studies. They look quite different and will depend on what the study is about and what the study needs are. And then we have developed and are continuing to work on this an evaluation process so that we can think about, well, what difference is this making to our research, and really making it central to what we're doing. So just the last few minutes of my presentation, so thinking about why it's important. So historically, I don't think researchers have given this as much thought as perhaps they should have. And these quotes I've heard over the years, so because it improves our research, but not really sure how, because it's important, because we have to get funding, because the public have a right to be involved. So that sort of, it comes very much from that citizenship model of involving people in things that are about them, services and so on, as well as research. I think we've come a long way from there. So if we think about public involvement now, it's very much embedded in the research infrastructure, and the National Institute for Health Research, and they fund a lot of UK health research. They aim to make public involvement as important to research as accurate measurement. We also, as researchers, have national standards for PPI and principles, and more available guidance to us than ever before. And there's lots more positivity across all stakeholder groups, shared learning about what works, which is really good, and growing evidence of positive impacts, which I think really encourage other researchers that perhaps haven't done PPI so much to start to engage with that. But we do still have a way to go to sort of achieving that goal to make public involvement as important to research as accurate measurement. And there are quite a number of studies now. We are researchers, so of course we've started to carry out research about this. There are research that sort of tells us about specific impacts on research in terms of improving research, and impact for us as researchers when we work with members of the public too. And for me, I can confidently say today, I think that the key benefits for research are that it improves the relevance of research, because we're doing research that matters about the people the research is about. It improves the quality of our research, and by improving relevance and quality, it will improve the impact of our research. And I also think it will work towards improving public confidence and trust in research too. And I've got this slide here, but I think our parents will probably be able to tell you more about this. But the benefits for the public can be, the same as they are for researchers in terms of contributing to research and making a difference, learning more about your health condition, meeting other people, developing new skills and knowledge, and getting involved in other activities off the back of getting involved in research. Similar for researchers too, I think. So again, reminding us of why our work is important, and really thinking about making a difference to the children and families that we're working with, and learning more about the research topic, because we're bringing in that expertise by experience, meeting other people, again, developing new skills and knowledge, and then really, improving our research and the impact that it can have. And I've got a final slide that I wanted to share. In terms of, it's an article that was written a couple of years ago by a couple of researchers, and they suggested that maybe we don't need to carry out lots more research to try and understand the specific impacts on individual research projects, because for them it's about bringing experiential knowledge into the research process. And by doing so, it means that research experts learn from experts by experience. Experts by experience learn from research experts. And that ongoing process changes decision making that happens in research. And I think this quote nicely captures why that's important. So for them, they say that PPI, so public involvement, it fills the gaps in researchers' knowledge, and that gap is really around their lack of experiential knowledge. And that gap, that lack of experiential knowledge, has the potential to influence any and every decision that they make as they design and carry out their research. So I'm going to finish my presentation now, and we're now going to show you the recording that our parents have contributed to in terms of their experiences and perspectives of PPI and why it's important.
Over 20 years ago, we responded to a request by SPRU, Social Policy Research Unit in York, for parents or carers of disabled children to meet with them to contribute to their research. This is now in collaboration with York University and Martin House. Both Eva and I saw this was a chance to use our expertise to inform research that could bring about improved services and attitudes towards children like Adam. Looking back to those first encounters with SPRU, what struck us was the way our experiences were valued. This has not always been the case in our dealings with service providers. Rather than be treated as an inconvenience, we were welcomed as partners. We were able to contribute to tenders for future research, to ongoing projects, and to see the finished product.
Research is important to me because my son Joseph died from cancer in 2017. In the 4 years following his diagnosis, he was involved in a lot of research, and through this I could see the benefit to him and the possible future benefits to other children and their families.
The research into the rising numbers of children with life-limiting and life-threatening conditions has helped to show that there is a real need. I know particularly at local authority level, services are designed looking at groups like SEND or medical conditions, and this is quite a small percentage, but when you then look at those rising numbers and the impact that bad services can have, there is such a really clear need there to make sure that support and help is there in the future. So I think it's a really impactful piece of research because it's the numbers and that's what's needed.
And I think as well, one of the things that when after the conference we came along to one of the first sort of the parents groups with yourselves, one of the things that we was keen to get across was we wanted to be reassured that any research would go towards change or try and help go towards change, and it wouldn't just be put in a book on a shelf. And one of the things that we've been impressed with all the way through is how passionate yourself and Lorna and Joe are, that any research that is done will hopefully bring about change, and it won't just be research for someone else to research years down the line.
But you need the research to back that change up and to say, do you know what, this actually works? And that won't happen without real theory and real research to back it.
It's great that people are, I guess, so interested in research, and that and I think the more organisations and the more individuals that have that interest, the more ability there is to take research out to more families, because that's what's needed, is giving people the confidence to get involved, and giving people the opportunity and the means to get involved, in order to get that breadth of experience and get really impactful research.
There was a session where you got to write down all your sort of topics that you were keen on, and that was quite good because everybody had different topics. My topics were completely different to what Christy wanted. I
mean, I can remember, people putting on about chaplaincy, for example, on the board at this on a post-it, and obviously that's a project that you've got coming up, and the same with sort of early days projects and things like that. And those were all kind of things that had been put on those post-it notes, and it's really positive to kind of see those things starting to come to a point that a project is either being done or has been developed or funded. And And that, as people who wanted to get involved to see systemic change, that's really reassuring.
I became involved in PPI to help make sure that research is focused on the right things, and so that some good could come from Joseph's illness and death. That what went well can be shared and what didn't go well can be changed, because you can't know what it's like to care for a child in these circumstances until you've lived it. Doing PPI for the Martin House Research Centre is my favourite one, because I can see how the Family Advisory Board is listened to. I can see the changes that are made to research because of our discussions.
There's a phrase that says, nothing about us without us. And I think that's true across, obviously, all disability, all health, studies and everything. And wherever you involve people with lived experience of what you are researching or teaching or providing, that has only got to work in your benefit.
So it's been really interesting and really powerful to have an opportunity to input and share things that, perhaps we've experienced or felt within the system, and then find that actually that is the same for other people as well, and that there is a means to make a difference and bring about change by sharing those views, and then kind of getting people's wider experiences, and having the opportunity as well to input into wider pieces of research that come to the group has been really interesting. And there's things where I can input and add something, and there'll be things that I just don't have the experience of, but it's still a really great opportunity to hear about other areas of work as well.
When we've been to various meetings, professionals that we come across have an idea, or their ideal of how the system should work from their point of view. But as you know, from a parent's point of view, that can be completely different. And so I think it's important that you hear our parent side of things and how we think it should work and how we would like to see it work, because we're the customer, and surely it should be tailored to us, to our children.
Adam, who is now 26, was born in difficult circumstances, which left him with very complex needs. Perhaps it's needless to say his birth was a life-changing event for Eva and I, and for Adam's closest sibling, Mark. We both had to abandon our careers and concentrate on caring for Adam, and set about enlisting the many professional services that Adam would need. These services may exist on paper or in statutory duties, but access often depends on the capacity of parents or carers to fight for them. In this very steep learning curve, parents become experts in their child's condition and what should be available in the way of support and treatment.
I think because family involvement is really important, just to kind of bring up what's happening on the ground, and particularly as things change so much over time, and services evolve as well, and just to be able to input. My son's condition is very rare, so our experience is perhaps not the same as other families, but there will be themes that run across. And I think what's great about having an advisory board is having people with all those different experiences coming together and identifying what those themes are that everyone's experiencing at the moment.
There's a huge benefit to you guys as obviously researchers and to the projects, but there is, absolutely, it's a two-way thing, and the families get so much from that as well.
We are sure that this collaboration between parents of disabled children and researchers has contributed to an improved quality of life for both disabled children and their families. It gave us a forum where we and our children are valued and given agency. Last of all, we met and befriended dedicated people, both researchers and parents, in a common cause.
And I feel like Joe, Lorna, Andrew, the whole team genuinely want to hear and incorporate what we have to say and it isn't always like that everywhere else.
There is still such a stigma around children's palliative care and children's hospices, and without research, that's not going to change.
It's also a very therapeutic experience to talk about Joseph, and a real pleasure to have the opportunity to work with other parents who have been through these experiences and who understand.
We are not alone, and we can bring positive change.
So before we move on, I'd just like to really thank Sarah and Steve and Eva and Jason and Christy for sharing those experiences and insights. And I think it's much more powerful than anything I said before that. And I think really emphasizes why it's so important that as researchers we work in partnership with families, you know, in all the research processes all around that research cycle. So now I'd like to bring in Lorna, Sarah, Mo, Christy and Jason. So Sarah, Mo, Christy and Jason are members of our Family Advisory Board. Welcome, thank you for joining us. And I'd really like to open up to questions from the audience. But also Sarah, Mo, Jason, Christy, if you'd like to add anything before we take any questions, please feel free to say anything.
No, just to say thank you very much for putting that together. That was good, very good.
Yeah. Yes, so well, thanks Steve, our AV guy, for that. Really great job of putting that together. Thank you.
Just got to say, you can't really say any more than what we've seen today. It's been an absolute amazing collection of little snippets and talks and videos and clips and memories, and I've not been crying, but I've just got an eye condition. But I'm glad I've got these on today because I have been crying. I'm a below fine, but you know, we parents do get passionate. But I think today's a reflection on that, and it's been an amazing journey. And today's an amazing day because we've got a show of parents that can get together and work together with professionals, etc., and kind of make improvements and changes, you know, which is amazing, which is what's happening here.
Thanks, Mo. So we have got a few questions coming through. So question from Laura. Such a great film. What are the challenges for researchers and for experts by experience, I'll say families for us, in terms of working together in research? Go on, you go first, Lorna.
I'm happy to go first. And thanks again. I'll echo Joe's thanks, and some beautiful photographs of the children and young people in that video as well. I think it's so valuable, Joe, but I'm just reflecting on, we have a new national study around end-of-life care for children and young people that has just been funded, and a few weeks ago we had our first parent public involvement meeting, and we had I can't remember, there was at least 10 parents on that, and we were very much talking about end-of-life care, and I could see how difficult that was for some of the parents and how tricky it was, but on the other hand how much they wanted to contribute. And what I find difficult to know is what is too much? And Sarah and Mo and Jason and Christy can maybe answer that from us. When shouldn't we be asking you these things? Because it can feel sometimes like we ask a lot of you, and your input is so valuable and it shapes our research in such a meaningful way, but it does have an effect on you.
I think it does, but there's a lot of benefit from those kinds of meetings as well. You know, just being able to talk about our experiences, you know, the good bits and the bad bits, and have validation from other parents as well. You know, if you're in a meeting like that and then someone else is like, yeah, I had that exact same experience, you know, it's not just me. Maybe this can change now because of us talking about it. And certainly I know with you, Joe, and Lorna and the Martin House team, Martin House Research Centre team, that if something has been a bit much, we can come to you and say, well, look, actually, you know, can you point us in the direction for some support, or or something like that. So having an avenue to go down, if afterwards you realise actually, you know, that's taken a lot more out of me than I realised, is helpful. Being able to communicate with the researchers is useful.
I think from sorry, I'm Christy, I'm off camera because I don't do being filmed, but I think from one of the things that we said initially was that when you bear in mind some of the conversations and some of the discussions that families like all of us have had to have or continue to have around our children, being asked whether we want to participate in a study or not falls fairly low down the list in terms of traumatic experiences. And, you know, obviously, you know, you have to ask and you know, there's ethics and all the rest of it involved. But I think, you know, do give families the credit to be able to make those decisions for themselves rather than be afraid to ask them in the first place. Because we are capable of saying no if we don't wish to be involved.
I completely agree, Christy.
I think it's true because of talking about stress levels, like Chris just said, they're quite nicely, or, you know, I think nobody can stress us out more than our kids, really, can they? So whatever questions we get asked, we know we've been through it once and we can go through it again, because we're always talking in a group and we always know that to help this group, someone's got to open up. And then once one starts, it all starts. And sometimes people can't just keep quiet because it's such a conversation, that it's so much input, that it's, you know, it's like a wonderful experience sort of thing. So, and we know we're giving that knowledge, be it good, sad, not so nice, and very deep, hard conversations. You know, we've had them as well, haven't we, in a group? And we do go forward with it because we're parents and we have to face it. And we face it all together. And I think because we're all together with the same similar experiences, that makes it that bit easier. I think might be the right word. It's not easy to talk about someone that you've lost or someone experience that you've had, etc. Like my son's been on ECMO, Navee's been on ECMO, where it's like more than intensive care. So how could I explain ECMO? I'm really not sure, you know. But it's sharing them experiences and then knowing that you've shared it for someone else to have that ability and strength and courage to share theirs as well. And that is a good feeling there, that you've given someone the courage.
Thank you, Paul.
Sorry,
go on, Christy.
There's a catharsis element to it, definitely. But we also do appreciate that sometimes that leaves you guys as the researchers trying to pin us down and kind of keep us on track a little bit.
I think it works. I think you also help to keep us on track actually as well. I think, you know, working closely with you, I think there's for me, I think in terms of challenges from the researcher perspective, I think what really helps within the Mansion House Research Centre is that we have relationships with you and we are working with you, and I think there are mutual benefits from that. So I think sometimes challenges for researchers when they first start to do patient and public involvement, and they don't have relationships. This takes time to get it working, and it takes time, you know, for you guys to trust us as well, in terms of that we're going to come back and tell you what we've done with the information that you've shared with us, and be transparent about that sometimes, that we've not been able to take something forward, or we've not been able to incorporate something, or where we have been able to really sort of incorporate your insights and expertise within the research. But I do think that takes, you know, time and commitment from all of us, really, doesn't it? So there's lots of questions popping through. I saw some of them we've answered actually just through that conversation. Why doesn't PPI always happen in research? I think it possibly links to what I've been saying about actually some researchers, I think, see it as this thing that's very different to doing research. And I think that was what's nice about my last slide. It really is just about us working together, isn't it? I don't know whether Sarah, Mo, Jason, Christy, you had anything to add to that?
Yeah, I mean, so in my experience, I do PPI for various different organisations, and sometimes even if it happens, it feels, certainly to me, like very much like a tick box exercise. We've done this so that we can get the funding, but no real intention to actually use any of the discussion or any information that we've brought to make any impact into the research. It's just, yeah, we need to do PPI, so let's do it. It can feel like that sometimes. Whether that's the reality of that, I don't know. But I think increasingly the PPI is in stuff, but it needs to be meaningful.
Thanks, Sarah. There's quite a few questions about sort of diversity and hard to reach groups. You know, is it different working with parents than young people? And we're working with quite a large group of parents, and we're working with a separate group of young adults. I think from our experiences, we need to do more outreach. I think it's really central that we have a core group of families that we work together with as much as possible. And I think COVID's really helped with that, because we meet more regularly now, and I can't wait until we can meet face to face again, but I really think it's helped to make sure that you're more involved in everything that we're doing. And it'd be really nice to keep that going. Someone asked about, the differences in terms of working with young adults and working with parents. And I have to say, it's easier working with parents, simply because I guess, are used to having meetings and used to being asked questions. And I think sometimes we know we can come into a room and we can ask you stuff and we can take away. And I'm not saying that's a good thing, but I think it does mean it's easier for us to start to establish those relationships. And we've really approached it differently with the young adults, in terms of making sure that right from the outset there is mutual benefit for both us as the research centre and for the young adults. So starting to right from the beginning, in terms of prioritising with them what's important to them in their lives, and thinking about how research can make a difference to that, and co-producing, starting off by co-producing a research project with them that has the potential to improve services, in this case hospital inpatient stays, so that they can learn through their involvement, if they didn't know that already, why research is important, and that we're really trying to sort of do research, I think, as Christy and Jason mentioned in the recording, to improve care and change practice, rather than doing research for research's sake. So we are working slightly differently, I think, with the young adults than we are with parents. Sarah, Mo, Jason, Christy, did you want to say anything about that? I know you held us to account really right from the beginning in the Family Advisory Board about, when are you starting the work with young adults? When are you starting the work with children and young people? When are you doing this? And I think that really pushed us to make sure that we prioritise that.
Yeah, and I think, one of the things that comes from the adult side, a lot of it is keeping you guys to account, in terms of making sure that you're getting the voices of the children who perhaps are less able to verbalise, or, as I said in a comment earlier on this morning, about those with cognitive or ability differences. And that comes through in a lot of our discussions, doesn't it, about saying, how do we reach those children and young people who perhaps can't communicate in the same way.
Thanks, Christy.
I think it's also with young adults as well. The word isolation will be kind of, not a new word for anybody really, because schools have closed, etc. But it's isolation that disabled people do kind of feel and experience quite a lot, sort of thing, before COVID, etc. And it's like an ongoing thing now, isn't it? So having these groups and a place where that you're in a group of people that have got a condition like you or similar to you, makes them feel that less vulnerable or less kind of, it's like, take my son Naveed, for example. He's got a trachea. He would love to meet other trachea children, because then he knows it's a normal thing. And he's met trachea people, and now he thinks it's normal to have a trachea, if you've got that reason for it. So it's kind of getting them to open up and understand their illness and meet other people and also help other people. And I do hope the video that Navee's made today has helped and inspired quite a lot of other children, because that's what Navee's done. He's seen people make things, do things, and he says, I can do that. And good for him, because he's done that, seen somebody. So I hope we get a lot of inspiration from what he's sent today through Martin House today as well. Yeah.
Absolutely. Thank you, Mo. Sarah, did you have anything to add?
No.
No. Lorna, I'm conscious of time. I suppose I did have a question for you, because I don't think we've directed any of the questions to you yet. And I mean, from your perspective, how do you see us working with families so far, shaping the centre and influencing, you know, the centre in terms of what, not just the research we do, but how we work and things?
I think it's had a huge impact, and we wouldn't have been able to make the progress that we've made if I think about my work about maternal health or our new end of life study, just to name two of our studies. But you know, PPI has been so vital across all of our work. We would have done some of these studies, but we wouldn't have measured what was important. We wouldn't have done it in the most effective way. We wouldn't have recruited as well, because we wouldn't have done things like use social media, which came very strongly from our family advisory board. And I'm a huge believer, and I hope that going forward, that the family advisory group, the young adults, and work with younger children will only grow and continue to inform what we do going forward. I mean, I just wondered, Joe, there's a few questions in the question answer you could probably answer, you know, on the chat function when we move into the next session, if that works for you.
Yeah, and I think just to add to that, I think it's, for me, it's also helped us to be, I think Christy's already mentioned it, a little bit less paternalistic.
Definitely.
That's a bit in there, didn't it?
Just a definite important point to make there. We do have, you know, I think we sometimes think that as researchers, clinicians can be paternalistic. I think it's really helped us to check that we are as well, and we do it, and really sort of checking us on those sorts of things as well. And I think as our research moves forward, we are sort of getting to that point where lots of research is starting to be finished. So now is the point actually we can really work with you to think about what those key messages are and getting them out to the right people, and making sure that they improve care and practice.